It's an often sensitive and often stigmatized reality, but a new report shines a light on the realities of female genital mutilation here in Canada. And a warning, some of what you are about to hear may be traumatic to some.
It was a moment of shock when we ended up at the hospital, and I started hearing kids crying.
Saran Ba was only 5 years old when she experienced female genital mutilation in her home country, Guinea.
We were told that we're going to get photos and get ice cream and chocolate because those are the things that we liked. And so we hopped in a car and we went. The pain is something that you cannot really describe.
Ba, who currently lives in Canada, recalls the trauma she had to endure after realizing she was lied to, being forced into doing something she didn't want.
They put me on a table and I started resisting because I did not want that to be done to me. I remember it took 4 adults to hold me for the doctor to be able to do what she had to do.
According to the World Health Organization, female genital mutilation or cutting is a procedure that is intentionally alter or injure female genital organs for non-medical reasons. While it is punishable under Canadian criminal law, Statistics Canada estimates between 95,000 to 161,000 women and girls living in Canada are either survivors or at risk of female genitalia mutilation.
There are instances where FGM is being performed in Canada. There are reports of vacation cutting as well, but the people that we spoke to, the survivors that we spoke to, either they were cut before they came to Canada or they had it done in Canada.
We're dealing with a lot of mental health, reoccurring trauma, but there's also a lot of physical implications as well. So it can go from anything from birthing complications to constant bladder infections to all sorts of discomfort.
A new report by Islamic Relief Canada shows 48% of 33 women surveyed experienced female genital mutilation in Canada. Rihanna Patel highlighting the gaps in the Canadian healthcare system to support survivors like Ba.
There's not enough information provided to midwives, provided to just general healthcare support workers on what FGMC is, exactly what the consequences are, and the type of care that it's required, but also the cultural sensitivities around it.
And that's why Ba became an advocate for survivors. Last year, she represented her country at Miss Universe, sharing her experience to spread awareness despite the stigma surrounding the topic.
The trauma for me, a part of it has left because I'm not ashamed of who I am. This is something that happened to me, but it does not define who I am as a person. But at the same time, another part of me is having a hard time forgiving that this has happened to me and I had no say in it.
It's really everybody's responsibility to protect children from child abuse, and that's what this is.
Not only physical, but it's also mental, because you are kind of brainwashed into thinking that this thing is a good thing for you and for society. And for the longest time, a big part of me believed that too.
In Edmonton, Hiba Kamal-Choufi, City News.